So, good evening, everyone. Let me welcome all our speakers and our audience. Uh, this is Ravi Gupta. I'm editor in chief of a magazine called Digital Learning and also CEO of Elets Techno Media Private Limited. And we also run a magazine on health, banking and finance, and government. And today we are having this panel as a part of Healthcare Transformation Summit, which is the virtual summit we are holding. More than 70 speakers we have for over 2 days, and a lot of hospitals and government officials from the healthcare sectors, diagnostic centers, and pharma companies have been participating in this summit as speakers and also as sponsors and delegates. So we welcome to the you all to the HR session here, and I can request our expert, HR expert, Runa Matra ji, to kindly take over the session and moderate the session. Runa ji, over to you.
Thank you, Dr. Ravi. Thank you for the opportunity for putting our HR experts together. We are very, very lucky that we have absolutely great speakers from various segments of healthcare industry. And I believe that for 2 days, Raviji, you had put together an excellent virtual summit, and we know that in your segment you are number one, and we are very, very proud to be part of your intervention in the education sector. And what can be better than when you are actually connecting the higher education industry with the corporate world, and especially with this sector, which is healthcare. I think this is need of the hour that we bring all the views and thought leadership of our great speakers to guide all our audience. And of course, we have various inputs from the people we keep on connecting with. And I think it's an opportunity that we listen to our expert speakers who would be bringing in views that how they had been handling 2020 differently. We all know that for last decade we had been looking at healthcare industry already in a different scale. We are looking at globally that how this industry is changing the infrastructure. As HR, they're already enhancing the policy and the value creation by HR as business partners. I keep having conversation with this fantastic CHRO head HRs who are today with me, and I know they are extremely busy because they are working with their people hand in hand. It was actually very, very difficult to take time out from their busy schedule and bring them in for this 1 hour session. So I think what we are going to do today to make sure that we learn and make use of this hour we are going to spend together. I'm going to ask each one of my co-panelists to share their view. To begin with, please give a small introduction, because your introduction is also in itself carries a lot of weightage in terms of your expertise, your background, your how you are bringing together this prominent industry, and making sure that your people management is the biggest element which is required today, considering the fact that there are people in this industry who are probably overworked. They are actually angels who are supporting all this mankind in a very, very different level. I think many of us look at you with a with that view, as I mentioned, as an angelic view. So I think what is very, very important, that how are you managing, how are you supporting, how you are looking at all this satisfaction of people who are working with you day night. And I'm sure you're already experiencing lot of productivity issue, because they are expected to work in an increased productive environment. So how how you're coping with that? There are many, many, many such questions. So to begin with, I'm going to request Farhad to share some background in terms of your brief introduction in couple of lines, and then also share your views about how you're managing. Don't limit the pointers I give you. Please share as much as possible. Each one of you are requested to speak for around 5 minutes or so. Once we'd have 5 7 minutes conversation from all of you, then we will get on to a round table, because Ravi has loads of questions. So Ravi and I are going to co-facilitate the session today. So Farad, over to you.
Runa and Dr. Ravi, and for giving us this platform to speak on this subject, which is very important for everyone. Let me introduce myself. I started my career way back in 1986 with GSK, GlaxoSmithKline, and I worked with this company for 19 years. Then I worked with Johnson and Johnson also, and my last assignment was with Amneal Pharmaceutical. It's a generic company in US, but they have their headquarters in Ahmedabad and manufacturing units in Ahmedabad. I joined Mankind May 2019 last year, and this is my basically I belong to Lucknow, and I'm a totally pharma guy. I have my all experience in pharmaceutical companies, but that this year is definitely is a very challenging year for pharma because of this pandemic. All everybody is aware about this. The whole world is facing this crisis. But I think I would say that we have learned many things in pandemic, and being a big company, we have 30 plants all across India, and we have a very huge big manpower also, sales force around 15,000, and we are working in all therapeutic areas, and we have a R&D center also. More than 1,000 scientists are working, and we are going for US market also. We are there in US market also. So, but this pandemic has given a new direction to us as a leader. I would say that being a leader, we got a different direction from the because of the pandemic, and we have learned many things. We faced the challenges that we wanted to keep our plants operation every day, and we were successful that our all plants are working from the very first day of lockdown till date. Not a single day our plants are stopped. Actually, this is the great achievement for the company, and since we started facing this problem, and then after 7 months now we are having a more relaxed atmosphere in the market with respect to the customers like doctors, hospitals, and all. Even still, the cases are rising again in Delhi and all across India. But I could see that the people are facing this issue with more courage, and even the medical fraternity also. They have shown a great courage also. In the same way, the manufacturing companies also have done the great job, including Mankind Pharma. Even we started facing the problem. All companies in India are facing problem. We're facing problem from China, APIs and all. But somehow this problem has given a great scope for the Indian pharma industries to become a leader in the world, and I think India will become a pharma leader in the world within 2 3 years because of this pandemic has given a great opportunity to leaders, and the government also has given a lot of mileage and leverages for the pharma company who are interested to have more uh, manufacturing plants in API and all to tackle this kind of problem which is coming from China. On the people front, I would say as a HR or the healthcare industry, I think it is a great opportunity for the HR leaders actually. So they have to take care of their employees and their protection, and to keep the business continuity on. And so it's a lot of things were there, and skilling, reskilling, and managing people who are working from home, especially at corporate office. Still, we are having this roster and all. So, I mean, some unexpected kind of challenges came in the industry, and the leaders only, the senior leaders and the cross-functional leaders, they came forward and faced these challenges. They converted into opportunities, And that is the good story of our company, that we are working, our business is going on. We have never stopped our business, and we are doing exceptionally well. If you see the data, mankind is climbing the ladder of success with respect to the ORG or IMS data, and we are number one in the country with respect to the prescriptions. Doctors are prescribing our products. So it's a successful story, I would say, in the pandemic, where but at the same time, if we see the overall situation all across the world, I think it's a great loss with respect to the jobs and all, many small scale industries and the business from the people. It's a great loss. At the same time, the companies have shown a great business also, like e-commerce and all, and now the people are also used to, now they are buying goods online. And I was reading that even the most of the companies who were struggling 3 months back, now they are having a great demand. It's a complete paradigm shift with respect to the business opportunities, whether it is healthcare industries. Even you will find that many organizations, they are taking great mileage from e-commerce, and people are happy to buy the goods also. And even the companies also have changed their strategy and policies also with respect to the return of the goods and all. They have a strong network now, and advancement, technology advancement is there. And as for HR processes are concerned, that also has taken a new direction. Many companies, including our company, we have adopted a very high class advanced technology advancement, whether it is AI and other apps also. So I would say that it's a great concern, but at the same time, it was a great opportunity for the leaders to convert this issue, this problem into opportunities. So from my side, I think we have done well, and the India will do better even after this pandemic also. Thanks, Rona.
Thanks, Farad. Congratulations for contributing to the society, even if it's business, but it's important that you are apt. I believe I remember you talking about how your 30 plants are up always on their toes and extensively working towards providing the means to people. And I think when we are saying India to globe, I think we are very proud that we have you with us and we have organization like yours who are, giving that right input to the industry well on time. And this paradigm shift you talked about through technology and advancement through online business, I think you are going to really show as as guiding light to a lot of people how to grow their business. So Ravi and I will come back during our roundtable discussion. So now I am going to request Jagannath. Jagannath belongs to a very interesting organization, and we are all ears to learn from you, Jagannath. So, next 5 minutes is yours, your introduction and your experience sharing. Thank you. Um,
I
I
think we
think
lost.
Jagannath got dropped, and it's sometime, it's very cosmic that suddenly we saw Bhupender taking charge of the speaker's, you know, view. So, Bhupender ji, anyway, I was thinking about you that how interestingly you have, as a HR leader, given your, perspective
Runa?
to multi-industry. So, Jagannath, I have moved now towards Bhupender ji because he's all prepared with mask, and we are going to request him to remove that because we are actually preparing him for the next round. But Jagannath, if you're
Sorry,
comfortable,
Runa,
we'll
call
come
got
to you.
disconnected.
Yeah, are you
No,
fine,
I'm
Jagannath, to
comfortable.
speak?
No, I
So
think that
Bhupender ji
I'm
will
back now.
first go to Jagannath, and because it's a nice sequence of the organization you represent, so I kind of thought about that. So let's now hear from Jagannath. Yeah, are you fine?
Okay. Yeah, I'm fine.
Yeah,
Call
fantastic.
got
Thank you.
disconnected.
No
See,
problem.
basically, I have 21 years of experience, 16 years in pharma, and I have worked in LG Electronics, and I was heading a regional HR head for a pharma, the Piramal Healthcare. I was heading a human resource head for a Apotex Pharmachem. Now I'm leading a business HR and compliance for Biocon. That's what is about my background. And about a company, it's a very interesting phase for a business as a healthcare and also for HR. In Biocon, it's not only Biocon, because each and every day, if we could able to see that from March 28th or 25th, and each and every day the government is coming with a different announcement. We are not very clear about what we have to do and how we have to give the confidence to our employees and leaders, and we have a lot of challenges at the initial phase. Now we have a fair idea how do we handle the cases, and how do we handle the critical cases, how do we support our employees, how do we do preventive, and if it is a affected, how do we react to the people requirement. All this is completely set. I will give some kind of different perspective. One is when we have an initial phase, when we have a limited resource, it may be right from the people, those who are coming to company, or the infrastructure available in the shop floor. We have to prioritize our product, either which product have to line, and which is important to the market, and how do we ensure that our patients are getting the medicines without affecting a supply. Prioritize for the the product and the people and the process, and in turn we have to give a confidence to the people that those who are coming to facility will be protected. They have been given a proper the equipment, proper PPEs, and proper support to perform better. And in turn we are giving the confidence to the family members that yes, the employee can come to company, still they are okay, we will be able to support to them. And if you see that from that perspective, the leaders are pitched in. The leaders are given a lot of input from a the company perspective. They gave a lot of even the shop floor level persons. They understood the need of the hour. They come up with the requirement of the business process changes, and what are all the protocols to be followed in COVID, and all these kind of changes, which is very big thing happen. And obviously which is costing a lot of cost of operation is gone up, and the technology changes. If we see that especially the manufacturing setup, we have a people those who can work from home, and we have to identify which department how they can work from home, what kind of infrastructure to be provided, what kind of security system to be provided to access our database, and how do they create a content. Especially in pharma industry, we have a set of the standard operating procedures, and like something like the data creators, reviewers, and in turn make a checker process. And we have to work on all the process, because when somebody is working from home, how do they get into SAP access, how do they clear the entry, how do we factor into our standard operating procedures. One side we have to work on a procedure, one side we have to work on the policy aspect, one side we have to work on the process product, and it is a very dynamic scenario. That too is within very short time, because though the government is given opportunity for us to work, but a lot of the clarity is not there between a central government and state government, especially when we have a multi-location facility where I was handling the the Telangana, Andhra, and Bangalore. If you see, the different state have a different terminologies, different practices they have come up with, different need, because some people will say that we have to operate in one specific cover. Some people will say that we can operate inside by keeping the employees. Some people will say that no, we are not supposed to hold them. A lot of dynamics which we could able to see. This is what is, from the people perspectives, it's a great opportunity for us to see that how best we can optimize our resources, which I mean it is how we can create the infrastructure for the people, and how we can try to make sure that they have been connected to the business. Yes, obviously when they are working from home, their productivity level initially it is little bit difficult, because they also have to accustom to the new environment. And especially the leaders, they also have to understand, because earlier the work environment is they will be having a face-to-face interaction, they will be interacting with them on the output, they'll be able to monitor closely. Now it is a total different dynamics. They have to have a trust factor, collaboration with the leaders, Communication is a very key when the people working from the remote location, and in turn a lot of people working inside the shop floor is they need a constant instructions, sometimes the guidance from the people. Which is really, put a lot of challenge for us. In turn, when the people, those who are not able to work from home, and they also have to come up with a lot of training requirement, and it may be related to how to operate MS Teams, or how to operate a different kind of the communication tools, or the data creation tools. We have a lot of new things which we have introduced our company to facilitate our employees. These are all the changes happen. And right from the talent acquisition side, because initially the outside people not ready to come to for any kind of the interviews, as you know that. But still we have to prioritize our business requirement, and we have to come up with the onboarding requirement, the face to face, some kind of teleconferencing system. We have to trust the people only with that. Even though the senior most person who can, who's joining as a vice president or president level, we don't have any opportunity to have face to face interaction. We have to go with only the teleconference and the video conference, and then we have to go based on that. And still the person is not able to join physically, because I have a lot of recruit from the different countries, and they are all working still from the different country location. But we have to create the trust to them, because initial phases, if the candidate joins, we will be able to build the confidence. Now it is totally changed, so that the talent acquisitions, the onboarding process, onboarding, the e-exit, e-onboarding, a lot of changes happen. And L&D structure is very important, because they played a vital role to create opportunity for the people to learn, to come up to the technology requirement, process requirement. Runa, is it okay? That's all from my end. If anything specific question, I'll be able to help to understand. I'll be able to explain. Thank you. Thank you,
Thank
Runa.
you. I think I was so keenly listening. Uh, I while a speaker is speaking, I have humble request to my esteemed speaker to keep their mic on mute to avoid disturbance. Because Jagannath, I think, had a little abrupt end because he thought I'm speaking. No, I was actually all ears and listening. But I think the most interesting part, Jagannath, about your thought leadership was the way you had depicted the dynamism of your organization, which is also somewhere in the industry, and the learning from you, that the velocity you had, the speed you had to follow to listen to the compliance part from government, also enabling your organization not only from employee standpoint, also to balance the risk which their family is experiencing. I think that was a very, very strong point. So while Farad talked about the paradigm shift, you talked about the dynamism and also productivity. I think you both talked about, and in fact, the way you both talked about technology piece, that why when you actually have to operate in a certain challenging environment, how technology supports. But the way Jagannath, you mentioned about upskilling and digitally skilling your people to use your ERPs and all the standard operating procedure. Kudos to you and kudos to your team. I think we would have a very, very interesting input from Bhupendraji, who is representing a very esteemed organization and also managing plants in multiple places. So, in spite of all odds, is traveling between them. And so, Bhupendraji, we are very, very keen to know how this new industry is treating you and what all new experiences you are going to share with us. So, over to you, Bhupendraji.
All friends and HR fraternity. I think it was a good opportunity given by China to at least revisit our mindset, revisit our thought process, revisit our whole thinking process. Right? Uh, we are into the plant wherein we manufacture health product like Complan, then we ghee, then we manufacture sugar-free chocolates, etc. And many other products like Nycil powder, etc. So not even a single day our operation was stopped. Not even a single day. So what are the challenges? First, I would say that all support staff, whether it's HR or finance or purchase or store, all supporting staff was operating from home. So that was one initially decision taken that let everybody start working from the home. That was done, and IT has given very good support to every indirect staff. However, the plant is concerned, we took the permission from DM and enabled our bus services, continuous bus services. There was not even a single day stoppage, and created immediately infrastructure within the company, sanitizer. Now, without sanitizer, no bus will enter, no car will enter, no nothing will no enter. Proper mask immediately encircling for the social distancing. We ensured that we will not deduct salary, even if any employee is not able to come because of COVID, fear or anything. So not even a single day salary was deducted. That was first confidence we have given. Beside this, no, we have given oximeter to the employees. We have distributed vitamin C, vitamin zinc tablet. We have distributed kada, and the kada is made a practice for the morning and evening. Instead of beside tea, we have created the kada system. Morning arsenic album also now we initiated, and beside this, we have also taken a lot of initiative for the health and health care of each employee. So we any person now we in each plant we had a challenge. Some people that tested positive, we have given quarantine 14 days, 21 days with payment. Similarly, all testing, whatever antigen testing was carried out, the company paid the full money, and employees who were asked to stay at home, even whether it's a workman or a supporting staff, everybody was given paid salary. So not even a single pay was deducted. That was a courage from the management side. Uh, that was a very good job. And beside this, however, all HR practice continued as it is only. The online induction, online training, everything was online. So that was a beautiful part. And plant people continued working, and we all those workmen who reported at the plant in time, we have given additional incentive of 300 rupee, 400 rupee apart from their salary as an incentive to each workman. And these are the in fact initiative for confidence building. And our plant did not stop even for a day. Hello.
Yes, we can hear you. Your video is still, but we can hear you.
Okay, coming. Okay, so our plant did not.
Yeah, please continue. Oh, I think Bhupendraji got dropped. He was taking the session from being on the road. So I think we all were very delighted to know that we had been listening to horror stories of various organizations regarding layoff, furloughs, job losses. I think when we hear that and how an organization takes care of their employee, both at plant level, at work from home level, I think Bhupendraji was depicting a great best practice. When you take care of your own people, they take care of others. I think that is a great message Bhupendraji was giving. So with that, I would like to come to Mohit. You have been in this hospital, which is a very strong part of the healthcare industry for many years. First time when I met you, you were in Gangaram Hospital, then couple of hospitals. You have done great job. The biggest thing before you start, I would like to share with this group here and the audiences. Mohit goes all out to share the requirements, profiles all the time, very openly, very transparently, allows people who are actually looking for jobs to quickly connect with him. He handholds them personally, being head of HR. This is one element. If all HR can do, I think a lot of unemployment issues will be, probably to certain percentage can be reduced. This personal touch which Mohit gives, I think that is commendable. So Mohit, I won't steal the thunder, I want you to share. So please go ahead and share about yourself. And if Bhupendraji, if you couldn't complete your speech, we will come back to you. We have very soon a conversation as roundtable along with Ravi. So over to you, Mohit.
Yeah, first of all, thank you very much for giving me this opportunity. I'll give you a very small briefing. Myself, Mohit Gupta, I am heading the HR of Narendra Mohan Hospital, which is called the 500 bedded capacity hospital. I started my career with the IT industry. I was making the software for the different industries. Then got an opportunity to promote the software HIS system in the hospital for developing a different type of tools so that the communication will be come out in the very small way. I just start with my education part also. I schooling from the government boys senior secondary school, then come out from the graduation from Hansraj College, Delhi University. I passed out as a BCom honors there. Then after that, I completion my the post graduation in MCA and the MBA in HR, and I just completing my law graduate also from Delhi University, and I'm pursuing the PhD program in human resource management system. So this is a very small briefing, and I started my career with the healthcare industry and worked with the Gangaram Hospital, Fortis Hospital, Medanta Hospital, and now, as I told you, connected with the Narendra Mohan Hospital. And I just go through with my all seniors, which is recently giving the very small briefing about the experience and the current challenges there, what they face out. So I would love to share my experience also, which I really face out in this duration of pandemic situation. Actually, when the pandemic situation is comes there in the month of February and March, this is a really a one of the very big challenge for us. In a very honest way, this is a very crucial time for healthcare industry, because when we stand for to deliver the services, the staff is in the meantime they are not very really cooperative for that period, because the COVID part is a very the communicated diseases. So everybody is very frequently to come out in this frame. Ki now I am will be a COVID, I will be the COVID. So every next question is how to save the life and how to save the job and how to save the services. So when we are in the industry, we got our challenges of the patients from the different side. They are coming for a treatment. So suddenly gotten the disaster stage there in the healthcare industry. Also, the people are suddenly leaving the jobs just because for the safer side. Because we are a direct communicator with the disease when the patients come with any type of disease. So this is a very first challenge. Who will first stand in front of the patient to diagnose the first part? Ki you have the cough, you have a fever, whatever the disease you have. So this is that at that duration of our time when we stand our colleagues to check up these formalities to shaping the right direction of the treatment, they have a very hesitation. How do I talk? Why should I go there? Who will be responsible about my life? There are the so many questions are suddenly coming on my head, and honestly, at that this time of duration, I also very stuck there, because management is also doesn't have an answer. Okay, what you will should do in that duration of a time, because they also don't know the exact what are the policies there, what are the protocols there, because insurance companies also shut down there for the time being, because the insurance company is not supporting to the in a different way of the reimbursement and putting a claim. So many challenges there. And also this is a challenge, the parents is continuously pushing a phone to me in a different direction. Please relieve my uh, child from your job, because the life is very important, insist of to putting a job. So honestly, the sometime I was in the standing in that situation, what should I do, what should I do? There is no answer there, I'm totally blind there. Then I suddenly realized that we should have to stand with the my colleague first, because if they feel ki there is no support there, so how they will be survive there. And honestly, in the month of the April, that was a situation is there only the 15 nurses. That is a very matlab, I cannot think about in my dream also. Only the 15 nurses was survived with me at that time of stay. The rest of staff nurses and other nurses had suddenly drop the job because you don't have the transport facility. Borders are continuously sealed there, and also that is a challenge कि doctor is also not easy to reach on that particular place. So we have a shortage of a doctor, we have a shortage of a nurses, and the most important shortage of your technical staffs there who will collect your first primary part of our samples. So this is a stage when we have to stand like that कि I am the nurse, I am the technician, I am the doctor, so I play the multiple role with my colleague, and timely to motivate them in the different direction. And the situation was that they are not interested for money. Whatever the allowances you are offered, they are not bother about for single allowance there. They only think what is the protection about my life if I will be find out any COVID, because there is no protocol about the treatment, and we easy to got to know कि there is a death there, this is a death there. So everybody is concerning about that कि if suppose I connect with the COVID coordination, COVID communication, so who will so this is a question कि who will be the responsible about the life. So when we have to go there, we have personally to put up my car to pick up the nurses from the place, because the border has given us certain passes there, because the passes is not easily to pick there from the any branches there. They have a lot of guidelines there. So I use my personal vehicle to put the taking our nurses from the hostel, because hostel is justly hardly for the 1 kilometer, but only the 1 kilometer is a big challenge because this is a border. So the border is not allowing for any transportation of any employee, any staff, any public place, public facilities there. So we went there to pick them there, and when we pick them there, they or most what are the very challenges there? What is the very challenge is PP kit. Do you have a certain only the 15-16 staffs who will stand on the duty and for a protection when the pp kit is wearing there? Honestly, when I wear this pp kit is one of the I one day I realized कि maybe I crash any second, because there is no easy way to take the oxygen. There is no easy way to sit there. You cannot walk comfortably, you cannot eat, and in fact you cannot go to the very small thing for a washroom also, because once you remove the pp kit, there is a certain formula there. You cannot use the dump card for take it zip there and to go there and to put up the dress again. No, once you out from the dead, this will be a destroy there. So this is a very crucial time, which is I never think in my dream also कि this time of comes in my life where the staff is not there and you have to perform for a life saving. And honestly, in the duration of that period, I lost my very close family members who has certainly death in front of my eyes just because of the covid, because, and we had called them for a treatment in our hospital, and personally to provide for the ambulance each and everything. So end of day, there are a lot of certain circumstances we were, honestly we were not putting the entire energy, but we realized कि maybe we are a failure. But honestly we are not failure, to be honest, because this is a challenge, because nothing in our hand. Our good team of our doctor who has a well trained directors in the pulmonology departments like Dr. Vivek Nangia and the other Dr. Manish Tripathi, who is the really a very brown branded for this facility services. And one more thing I would like to share with you: in the duration of that pandemic situation, I was appointed by the government of India as a nodal officer of my particular state. So when I communicated as a nodal officer, so honestly, this is a very big challenge when the government is asking for any query: how many PP kits you have, how many sanitizers you have, how many is the gloves and the other things is required. You can't believe it. We need look like a मतलब जैसे कहते हैं ना भिखारी की तरह मांग रहे हैं, मतलब जो we are saying कि we need 20 gloves, we need 15 gloves, we need a 10 sanitizer, and we were failure because company is also supporting the farmer like other my players is there, so who has already giving 100% support, but they are also stuck due to the transportation. They not have a facility how to move out the one particular demand to the customer. मतलब we were continuously approaching, they are ready to deliver, but they said, sir, how do I come, that your the border is not allowing me. And rates, it's marvelous, मतलब the 2 rupees is comes for 200 rupees, मतलब 198 percentage is high. So nobody's think about that, but where should I wear this cost? Because properties is going in the loss, patients are not willing to pay, because the one single patient treatment is comes between the 2 to 5 lakhs. This is a minimum area of a cost. If you will go for the different type of segment services, the costs will be a disaster for 10 lakh and 15 lakh. Those have come for the ventilator and other thing. uh, Sometimes people it says that this is too high, but actually this is not too high, because the staff is not there, we don't have a facility, we are taking a particular thing from the particular places which is cost is more than of 200 to 1000% hike as a routine demand. So challenges are very frequently there. And when I, as I told you, when I worked as an nodal officer of a COVID facility, so when we went to the CMO office, we started an interaction with the different hospital. So sometime I realized the few hospital is trying to say कि हमारे पास COVID patient मत भेजिएगा, because we are in a rush, we are not this way. But end of day, we are slow by slow, every person is putting a different mindset, because when the family persons comes in the challenges there, they are giving a support, they are trying to understand the COVID facilities, they are giving a support. Now today, the after the this 7 months of challenge, now the healthcare is little survived to provide the best better services. Now nurses and doctors are prepared to fight with these things. But in this duration of 7 months, matlab, I lost my sleep also, because the facilities, how to serve, every second is my second thought. What should I do in the next way? Because staffs is always easy to support. And yes, Roma ji, you had suggested a very nice way. In that duration, I helped a lot of persons in a different direction to providing a getting a different type of opportunity in terms of 10,000 salary or in terms of 2 lakh salary, whatever they have a caliber skills. We are frequently to distribute the entire openings whatever I got in my institute is related my institute. And we are pushing a personal intention to, in this duration we are not very rigid for an interview, and we are just helping to how to crack the interviews also. We are helping them also, because this time is not a part ki what you have a quality, the part how we can utilize the manpower in these challenges there. This is a very big thing. And in this entire scenario of a job, the work from home is not easy to survive for a hospital sector, because nurses, doctors and our side. And as a HR person, I cannot be do it from the, I try to start for a 1 day, so honestly the second day I immediately to rush for the hospital, because the our nurses and doctors says ki Mohit sir, now you are sitting home and you are saying ki no, don't worry, you have to come, we will take care. So for that point of motivational, I personally to come taking a challenge. I personally self my pass out from the COVID stage also. So when I was in COVID, so the things was also be controllable. I help to be the person and donate the bloods also, so that my blood is also be utilized there. And in fact, yesterday also I donated a 1 unit of blood for one of my relative who required really for the service of survive with the life. So this is a very small thing. Baki rest we need your wishes, so that the healthcare will survive to help the person. I just have only one small request in that entire scenario. This time is not a challenge what quality you have, this time is a challenge to support the person, because there's a one single person is not losing a job, this is a one family is losing a life. This is my just empathy. Thank you very much for that.
Thank you, Mohit. Such a emotional sharing. I think
No,
I
no, no.
completely got glued and कहते हैं ना जिस पे गुजरती है उसे मालूम है. So I think the way all of you are supporting, and my God, I think I mean I'm in loss of words how to even express our gratitude, because I have been speaking to people in other hospitals as well, Rainbow Hospital, Fortis Healthcare, you named some, you already worked, and recently a very good friend. He is in Hero Motocorp. I think all of us know Dharam. So he was talking about, how they collaborated with your ex organization Vedanta. So I think, to support their employees, there are loads and loads of best practices in terms of how to be not only looking at, like Farad talked about, like Jagannath talked about, and Bhupendraji also mentioned, and you actually gave a very, very emotional story, which is a reality, and I think all of us have immense learning. I don't wish that this thing can happen to any industry. We all do not wish that, but the learnings from you all, what we are hearing today, and I'm sure, Ravi, my humble request to you, for from the 2 day summit, I think you have a basket full of information to share with us, guide us. So I think, Ravi, before we get on to the kind of discussion which is more or less question answer round table, थोड़ा सा आप भी बताइए कैसा रहा ये 2 दिन. Why don't you also give us your experience so that we can weave the conversation accordingly?
Sure. I think, first of all, thank you, Mohit. You gave a very, very real ground situation story from a hospital. And over the last 2 days in our conference also, like, we had several hospitals from all over the country, their CEOs or their CXOs who have been talking about very challenging times, especially for hospitals and doctors and nurses and the technical staff. And they are the uh, I will say the big heroes in the, like, and especially in the initial months of the COVID situation. And I also heard from several hospitals when we in our panels that many hospitals faced several severe financial crisis because of COVID, because other facilities were closed down, and only COVID was allowed to operate. So uh, I think we heard from one of the speakers that thanks to China, that we are all the industries are forced to rethink about their purpose, their objective, their strategy, their vision. Like, the whole tables are turned, and like every industry is trying to reinvent itself. So I think if in the next round of discussions, if we can touch upon that, how this pandemic is forcing us to rethink our business, our HR, and our overall organization goals and visions. That point, I think, if we can address in our next round, it would be great. Thank you, Runa.
Thank you, Ravi. Thank you always inspiring us and give us a platform. I think काम सब करते हैं, लेकिन if you don't learn from them, there are loads of things we learn from each other, and that is where the continuity happened. In fact, I think Jagannath talked about business continuity. Both Farhat and Jagannath talked about reducing risk. I think Bhupender ji, Mohit, you all talked about protecting not only our employees but families, and managing, motivating. I think motivation was something where we all had gone through a kind of tide which I'm sure no other industry can talk about. So I think the biggest area where we can highlight in next few minutes, and it will be very important to learn from each one of you, is that almost we are at the year end, and we are looking at stuff with a different eye. We have learned from many things. How do we now approach our coming time? If we look at now, how do we spend November, December with a different mindset, and also with a lot of preparation, so that we can welcome 2021 with a lot of 2020 learning, and make sure that we sustain all the good stuff. As Ravi also pointed out, when Bhupender ji said they made us rethink, reshape, energize our environment. So that was a strong point. Of course, we should not thank China for that. Bhupender ji, I disagree, but I think what you meant was what important, that they shook us, that how do we change. So now that we have ironed that out, what is it you would like to give as your anecdotal point for our audience and for our future leaders as well, what to do differently in next 2 months and the coming year? So who would like to start that? So
Okay.
yeah, Bhupender ji. Starting, Farad?
As a surprise, hello.
Yeah.
So
Whoever
hear
is
me?
speaking, let's speak, and others can put on mute so that we can see the person
As
on
a
speaker. So, Farad, you're saying something?
hello.
Okay. No problem. Should I speak?
Yes, please.
Farhad, you can speak, please.
I can see his video is frozen. So, yeah, Jagannath, why don't you share your thoughts?
Yeah. See, one is what I was trying to tell you is, yes, we have learned a lot during COVID time. And as you know that the healthcare industry is always ready for a challenges, because especially when you are seeing from the regulatory audit perspective, and continuously changing the product line and continuously looking for the improvement, and which is not a new things for a change, because change is expected. The healthcare industry manufacturing is prepared for that, but the time frame is little bit worried, because in COVID, which is made all of us to change in very short time. That is what is a big thing, because if now we are prepared, because we are prepared that scenario too, because when it is going to come in future, from a perspective of regulatory audit, now virtual audit is started, and after virtual audit again there is auditors will be coming to manufacturing site, and we have to ensure that our employees are the following 100% the requirement of the regulatory audit, and also ensuring that the product quality and in spite of the technology improvement and continuous improvement, the cost of operation is gone up drastically, and we have to work on how do we improve our productivity, and how do we improve the people productivity, how we can optimize the people so that their productivity level can go up. These are all the challenges which we face as of now. And from future perspective, and yes, we are changing our talent acquisition strategy and learning and development strategies, because earlier our focus is the recruiting from the only the regional or some kind of different locations. Now the technology has brought us the scope for us to recruit the talent anywhere in the world, and which is a really good the strength which we can get it for our business. And the same way, the learning and development also is given a lot of chance for the people to learn 24/7. Earlier we have a classroom session and different kind of models. Now we have developed a lot of modules which can cater the people need, so that that is also another aspect. The learning and development can be the lot of tools, a lot of learning, the we have a tie up with the different institute, and we also created our own modules. We have our own certification program for employees to get into that, so that they continuously their skill can be improved. That is another aspect. One is the compliance we have to do, and the L&D and the talent acquisitions. And very important things in future is, and the continuously the product line is going to change, regulatory expectation is going to change. We are continuously on monitoring, and we will move towards that. And that's all from my side, Runa. Yeah, thank you.
So, we have 3 minutes. So, I would request Farhad, Jagannath, and Mohit to spend one strong minutes, and we have to hand it over to Dr. Ravi for the closing also. Yeah.
Okay, Runa, actually, you were talking about the how we will move further. Actually, I'll tell you, we already have done all the meetings, whatever the plan, the corporate objectives are set, and the new leadership also evolved in the world, and we also working on the agility and the resilience kind of leadership, which is very very important. We have learned in pandemic how to bounce back. Not only the employees, even the cross functional leaders and all. So our objectives, corporate objectives for 2022, even we are set, and our all meetings and everything is happening virtually. And we know that after 6 months and all the actual meeting will be done. So as for the business continuity is concerned, I think we are absolutely on the same page. Whatever we had done the planning 2 years back, being a proactive organization, so our plans are streamlined and as per the planned and which is implemented also. But definitely the new leadership style with respect to agility and resilience, we are working that how the leaders can become strong to face this kind of challenges in future also. So this is something which is I wanted to add. Thanks, Luna.
Thank you, Farad. Okay, Bhupender ji, Mohit. Mohit is settling down, so Bhupender ji, why don't you share? You are on mute.
I'll give you the only one few suggestion for everyone. Yes, this is the coming of next 2 months is again this is a very big challenge for us because Diwali festival is coming there, and a lot of staff is expecting for a leaves and maybe they've gone easily to come back on the duty or not to be come on duty. So that is the part of that. Ki our the team of a senior, the other colleague will have to be support of our junior staff, and instead to putting a workload multiple tasks we have to be support and to motivate on time to time and giving the learning perspective what is the next challenge is there. So not internally only prepare yourself, you have to be prepared your team also. This is my next coming 2 month challenge.
Very true, very true. Thank you, Mohit. Very nice.
Yeah,
So,
welcome.
Bhupender ji,
We, in fact, as a surprise, we have given a special COVID top up to all employees from the insurance side. Insurance side. So each employee, including workman, was given 2 lakh rupee top up, COVID top up. Rest all the 5 lakh and 10 lakh COVID additional COVID top up from the company side. In addition, now good news that with God grace, the Jairus Cadilla will be coming up with the medicine, final trial, perhaps in the year end. So that will be very good for the not only for the this company but also for the across the world. So pray God, it should we should survive. We should come over this tight, difficult situation and exceed and accelerate our business, exceed our business requirement.
very
So
encouraging, Dr.
continue
Bhupender.
working hard, continue working hard, and whatever loss took place will
Right. I think
that's
very
all from my side.
thank you, Bhupender ji. So we are losing you in between. So I spoke. Sorry about
Yeah,
that. So Dr. Ravi,
yeah.
I hope we had a successful and eventful day and the session and closure with the right kind of encouraging words from all our eminent speaker. So I would like to thank everyone for making it so useful and so directional for our audience. So with that, Dr. Ravi, to you.
Thank you, all the eminent speakers. I think each of you have provided a new angle and a new dimension of how this COVID situation was handled by your industry and your organization. And great to see that there is a lot of optimism for the future, and a lot of new vision is being developed, and new ideas are coming in. And of course uh, the point raised by Mohit on the frontline workers, especially the hospitals, their challenges are unique in this COVID situation till the vaccine comes out. So hats off to these frontline workers also. So this we will. I would like to thank all our eminent speakers, and I hand over this to my colleague Karthik, who leads our health vertical. Karthik, over to you.
Thank you, Dr. Ravi Gupta, and as always, thank you, Runaji. Your capability to get the stakeholders on the leaders on one platform, and your capability to moderate the session so well. And not only me, I have seen a lot of big people also appreciating your these skills. Thank you so much for once again moderating this session so wonderfully, Runaji. And thank you all the panelists for joining this very important session on human resource. And it was so interesting to know about all these issues which you have raised and discussed here. And I would like to thank you. And also, it is the last session and the closing session of the 2-day Healthcare Transformation Summit. And it was a great start, and it was a great event throughout, and with a great end, with such an important session. And I thank all of you. I thank all the audience. I thank all the partners for joining. I thank Mylan Pharmaceuticals for supporting this event, Glenmark Pharmaceuticals, Amazon Web Services, J Mitra Company and Private Limited, BPL Medical Technologies, Decisive Edge, and we thank Government of Uttar Pradesh for joining us as a partner, and NIC Government of India for joining us government partner. And thank again Runaji. And here we close the Healthcare Transformation Summit.
Namaskar to
Thank you.
everyone. Thank you.
So see you soon, 6th November in Radiology and Imaging Summit. We are organizing 6th and 7th November. We request to invite all of you to be there. And we are having a World Education Summit in November and December. So see you in all our endeavors, and please join us, keep supporting us. Thank you so much.
Thank you, sir.
Thank you.
Have a wonderful evening. Stay safe. Stay.
विश्व में हमने युवाओं की आईटी एनर्जी के माध्यम से अपना एक रुतबा खड़ा किया है और भारत इसके बात के लिए गर्व कर सकता है। दुनिया में हम आंख में आंख मिला करके बात कर सकते हैं। और ये मेरा साफ, मैं हमेशा कहता आया हूं, आईटी प्लस आईटी इज इक्वल टू आईटी। इंफॉर्मेशन टेक्नोलॉजी प्लस इंडियन टैलेंट इज इक्वल टू इंडिया टुमारो।